Have you ever visited your doctor for a regular checkup and been told that you need another test or screening? Many older adults agree right away because it feels like the safe thing to do. But not every medical test automatically helps you live longer or better after 60. In fact, some screenings can lead to unnecessary worry, extra procedures, or side effects that outweigh any possible benefit. As we grow older, the goal of good health care changes. It is no longer just about finding every possible problem, but about choosing wisely which tests truly improve quality of life. Modern medicine is powerful, yet it must be guided by reason and purpose. More testing does not always mean better health, especially if the results do not change how you live or how you feel. This is Dr. Sam Senior Health Tips, where we take a calm, science based look at how to stay strong, independent, and informed after 60. Here we focus on simple, practical wisdom that helps you make confident decisions about your health. If you enjoy learning how to care for your body with clarity and peace of mind, remember to subscribe and tap the bell so you never miss a new lesson made for seniors like you. In today's episode, we will talk about 5 common medical tests that people over 60 should discuss carefully before agreeing to them. These are not tests you must refuse, but tests that deserve thoughtful questions. Because the real strength of good medicine lies not in doing everything, but in doing what truly matters for your stage of life. By the end of this video, you will know which tests to question, what to ask your doctor, and how to make choices that protect both your health and your peace of mind. Let us begin. At number 5, we have routine full body scans, such as CT or PT imaging, done simply to look for hidden cancer. Many older adults choose these tests hoping they will find problems early, but the truth is that for people without symptoms, these scans rarely improve survival. What they often do instead is find harmless spots or shadows that cause worry and lead to more tests, more radiation, and sometimes even surgery that was never needed. Studies published in the Journal of the American Medical Association have shown that whole body scans in healthy adults can produce false positive findings in up to 40% of cases. In many of those cases, the results turn out to be benign scars, cysts, or normal age related changes. Yet these discoveries can lead to invasive biopsies or treatments that create stress and side effects instead of comfort. For people over 60, especially those with other medical conditions, the harm from radiation exposure and unnecessary follow up can outweigh any possible benefit. Medical imaging is an important tool when it is used for a reason, such as unexplained pain, weight loss, or specific symptoms that suggest disease. But using it as a blanket search for hidden cancer is not supported by strong evidence. Instead of giving peace of mind, it can create a chain of anxiety and medical interventions that reduce quality of life. If your doctor suggests a full body scan, ask clear questions. What exactly are we looking for? How likely is the test to find something meaningful? And most importantly, what would we do next if the scan shows something uncertain? These questions turn fear into informed decision making. Routine whole body scanning is a modern idea, but more is not always better. Your body does not need to be searched in every corner when there are no signs of trouble. Gentle awareness, regular checkups, and careful listening to your body are safer guides than radiation pictures taken out of curiosity. Choosing wisely means protecting your health while also protecting your peace. At number 4, we have aggressive diabetes screening and very tight blood sugar control. Many older adults are told that their glucose should be as low as possible, but this advice is not always safe after 60. The body changes with age, metabolism slows, and medicines that once worked easily can now cause sudden drops in blood sugar. These drops, known as hypoglycemia, can make you dizzy, weak, or confused, and in severe cases can lead to falls or fainting. Research in the Lancet Diabetes and Endocrinology has shown that keeping blood sugar too low in frail older adults increases the risk of hospital visits and complications. The study found that an A1C target between 7 and 8 offered the best balance between safety and long-term control. For most seniors, this range prevents excessive thirst, fatigue, and infection without putting the heart and brain at risk from low sugar episodes. The goal of diabetes care in older adults is not perfection, but stability. A slightly higher blood sugar level can be safer than a level that swings sharply up and down. It allows the brain to receive steady energy and helps you stay alert and balanced during the day. Tight control may benefit younger adults who can recover quickly from low readings, but in seniors, the same treatment can cause harm rather than help. If you are taking insulin or multiple diabetes medications, talk with your doctor about whether your targets are still appropriate. Ask what range is best for your age, weight, and daily activity level. For example, a retired person who eats regularly and walks each day may not need the same strict targets as someone with a recent diagnosis. It is also wise to ask your doctor about the purpose of each blood test. Frequent screenings or finger sticks may not be necessary if your readings are already stable. Simplifying your testing schedule can reduce anxiety and still keep you safe. Good diabetes care after 60 means avoiding extremes. Keep your meals balanced, stay active, and monitor your energy rather than chasing perfect numbers. Remember that living well with diabetes is not about strict control, but about gentle consistency that keeps your heart, brain, and body working together smoothly. At number 3, we have screening mammography for older women beyond the age of 75. Mammograms are valuable tools for early detection in younger women, but their benefit becomes smaller with advancing age. As women grow older, many breast cancers develop so slowly that they are unlikely to affect life expectancy, while the tests themselves can bring anxiety, discomfort, and the risk of unnecessary treatment. Research from the Annals of Internal Medicine has shown that continuing regular mammograms after 75 often leads to overdiagnosis. This means detecting small tumors that would never have grown or caused harm. Yet once found, they are often treated with surgery, radiation, or medication that can weaken the body. For a senior woman with other health conditions or limited mobility, these treatments can reduce quality of life more than the disease itself ever would. Experts from the U.S. Preventive Services Task Force recommend that women in this age group discuss the decision individually with their doctors rather than following an automatic schedule. The key question is whether you are healthy enough to benefit from early detection. For women with a life expectancy of 10 years or more and strong overall health, continuing mammography may still make sense. For those with chronic illness, fragile bones, or heart disease, the better choice may be to stop routine screening and focus instead on comfort, strength, and daily well-being. If your doctor suggests a mammogram, ask 3 questions. What do we hope to find? How would treatment help me at my age? And if something small is discovered, would treatment actually change my future or only bring stress? These simple questions shift the focus from fear to clarity. Regular breast self-checks, Awareness of new lumps and reporting any sudden changes are still important at any age. However, the goal after 75 is to protect quality of life, not to chase every tiny shadow on an image. Medicine should serve your values and comfort, not create worry where none is needed. Choosing whether to continue mammograms after 75 is not a sign of neglect, but of wisdom. It means you understand that good health is not only measured in tests, but in peace, balance, and the ability to enjoy each day without fear. At number 2, we have screening colonoscopy after the age of 75. Colonoscopy is one of the most effective tools for detecting and preventing colon cancer, but its benefit changes as we grow older. For many seniors, the risks of the procedure begin to outweigh the potential rewards, especially if previous tests were clear and there are no new symptoms. A colonoscopy requires bowel preparation, sedation, and recovery time, all of which can be harder on the body after 65 or 70. Complications such as bleeding, dehydration, or even perforation of the colon become more common with age. Studies in the British Medical Journal have found that for people who had normal results in earlier screenings, the chance of finding a serious problem after 75 is less than 1%, while the risk of harm increases steadily each year. For healthy adults who have never had a colonoscopy, it can still be useful once between 50 and 75, but repeating it routinely beyond that age rarely changes outcomes. Non-invasive stool tests, such as the fecal immunochemical test or FIT, can safely replace colonoscopy for many seniors. These tests can be done at home, carry no risk of sedation, and are quite accurate in detecting blood or abnormal cells. When your doctor recommends a colonoscopy after 75, take time to discuss your personal history. Ask whether you have any symptoms such as blood in the stool, weight loss, or ongoing abdominal pain. If not, ask how likely it is that the test will change your care plan. You can also ask about alternatives like stool testing or a flexible sigmoidoscopy, which is a lighter procedure with fewer risks. It is also helpful to consider your overall health and life expectancy. If you have heart disease, diabetes, or other chronic conditions that make recovery slow, the strain of a colonoscopy may not be worth it. The main purpose of screening is prevention, but once you reach an age where other health issues are more immediate, prevention must be balanced with comfort. Colon health after 75 is best protected by diet, hydration, and gentle movement rather than repeated invasive testing. Eating fiber-rich foods, drinking enough water, and staying active help your digestive system do what it was designed to do. A thoughtful conversation with your doctor can save you unnecessary stress and keep your care plan focused on what truly matters to your well-being. At number 1, we have PSA screening, which stands for prostate-specific antigen. It is a simple blood test that measures a protein made by the prostate gland. Many men believe that taking this test every year will catch prostate cancer early and save their lives. But the truth is more complicated, especially after 60. PSA levels can rise for many reasons that have nothing to do with cancer, such as inflammation, infection, or natural enlargement of the prostate that comes with age. Large studies published in the New England Journal of Medicine and the British Journal of Urology International have shown that PSA screening in older men often finds small, slow-growing cancers that would never cause symptoms or shorten life. Once detected, however, these findings usually lead to biopsies and treatment such as surgery or radiation, which can cause serious side effects including incontinence, impotence, or chronic pain. For many men over 70, the harm from these interventions is greater than the risk posed by the cancer itself. Prostate cancer usually grows very slowly, and for older men with other health conditions, it may never become a threat. The goal of screening is to find cancers that are dangerous, but the PSA test cannot always tell the difference between a harmless tumor and an aggressive one. That uncertainty often leads to unnecessary worry and medical procedures that do not improve either lifespan or comfort. Large medical studies and long-term clinical trials, including those published in the New England Journal of Medicine and the British Journal of Urology International, have shown that routine PSA-based screening in men over 70 offers little or no reduction in prostate cancer-specific mortality. These studies also found that widespread testing leads to substantial overdiagnosis and overtreatment, exposing many older men to complications such as urinary incontinence, erectile dysfunction, and infection without improving overall survival. Based on this body of evidence, most current clinical guidelines now recommend against routine PSA screening in men aged 70 and above and encourage shared, individualized decisions for those between 55 and 69. If your doctor suggests a PSA test, ask what symptoms or concerns make it necessary. Ask what happens if the result is high and what options you would have if cancer is suspected. Also ask whether you are healthy enough to benefit from treatment should something be found. These questions help you see whether the test will truly make a difference or only create uncertainty. For most older men, focusing on diet, exercise, and managing blood pressure and cholesterol brings far more benefit than chasing low PSA numbers. Simple habits such as staying hydrated, eating vegetables, and getting regular activity protect the prostate naturally. Knowledge, not fear, is your best protection. Knowing when to stop testing is as important as knowing when to start. In the next part, we will look at the 3 questions every senior should ask before agreeing to any medical screening, no matter how common it may be. Before agreeing to any screening test, especially after 60, it is important to slow down and ask the right questions. Many tests sound reassuring, but what truly matters is whether the result will change your care in a meaningful way. These 3 questions help turn a routine appointment into a thoughtful discussion where you and your doctor make decisions together. The first question is, what is my overall life expectancy and goal for this test? Every screening should have a purpose that matches your stage of life. If the goal is to find something early enough to treat successfully, the benefit should extend over several years. If other chronic conditions limit that timeline, a test that finds a slow-growing problem may not improve outcomes. Understanding your personal goals helps the doctor tailor recommendations that fit your reality instead of general rules. The second question is, if the result is positive, then what happens next? Many seniors agree to test without realizing that an abnormal finding often leads to more scans, biopsies, or medication. These follow-up procedures can bring stress, discomfort, and risk. Asking about the next steps helps you prepare emotionally and physically for what may follow. It also gives your doctor the chance to explain whether treatment would truly help or simply create new problems. The third question is, what does the medical evidence show for people my age and health status? Many guidelines are based on studies of younger adults, not seniors. A test that helps a 50-year-old may not have the same benefit for someone who is 75. By asking this question, you invite your doctor to base decisions on current research, not habit. These questions do not challenge your doctor's authority, they build partnership. They remind both of you that your care should be individualized, not automatic. The best medicine after 60 is not more testing, but better testing, guided by science, by goals, and by respect for your body's natural limits. When you and your doctor think together, you gain control, reduce fear, and protect your health with wisdom instead of worry. In the next part, we will look at the core principles that bring these ideas together into a calm and confident approach to medical care in later life. The main message of this lesson is simple. Good medicine after 60 is not about doing more. It is about doing what matters. Every test, scan, or treatment should have a clear purpose that improves either the length or the quality of your life. Screening without reason can create fear, waste time, and even harm the body you are trying to protect. Science now shows that many long-trusted medical tests must be used differently as we age. The body changes, recovery slows, and risks, once small, can become large. That is why the smartest care in later life comes from personalizing decisions, not following automatic routines. Your doctor's goal should match yours, whether that goal is to stay independent, to reduce symptoms, or to focus on comfort and peace of mind. Always remember three guiding principles. The first is individual benefit. Every test should offer a real possibility of helping you, not just fulfilling a checklist. The second is proportion. The smaller the expected benefit, the greater the need to weigh the risks. The third is partnership. No test is mandatory. Each is a choice made together between you and your doctor. Understanding these principles gives you confidence to ask questions, to say yes when the benefit is clear, and to say no when the risks outweigh the gain. It also reminds you that good healthcare is not a contest to find every problem, but a collaboration to protect your well-being. When you choose tests wisely, you protect your body from unnecessary strain and your mind from needless anxiety. You allow medicine to serve its true purpose, to keep you living well, not simply living longer. If this message resonates with you, please like this video, share it with someone who may need it, and subscribe to Dr. Sam's Senior Health Tips. Here we believe that knowledge, balance, and calm decisions are the keys to strength and dignity in later life. Here's to clearer choices, steadier health, and the quiet confidence that comes from understanding your body and trusting your own judgment.